What's up, everybody? We are live. We're going to let a few people come in. I see Roel's in the building. What's going on, Roel? Let's see. Where are we at? We got one step forward. What's going on? Great to see you guys. Great question there. Thank you. Let's see here. I think we're on Instagram. I hope so. Instagram, we are live. I see Roel's over there as well. Thank you, Roel. We love you. Heather, what's up? Great to see you. I see Brantley, Margaret, what's going on? Roger, good to see you. Love the Instagram crew. If you guys have questions over here, go ahead and put it in the comments. I'll be looking at this throughout the evening. Let's see who else we got. Coal miner's daughter. Hello, howdy to you. Cherry, hello. We got some people coming in. Thank you guys. Welcome to the show. Bianca, hello. Mark, I love it, man. I cannot wait for him to see this. The rumors are true. It is Doc's birthday today. And I tell you what, I don't think there's any other way he would rather spend it. He or myself. I think this is going to be a blast. I'm looking forward to getting to hang out with him, with you guys on his birthday. Stan, what's up? Great to see you. If you guys have questions, thank you, Margaret. Thank you, Roel. I'll make sure Doc sees those. We've got just a wonderful birthday here today. We'll have to ask him how old he is. Thank you, coal miner's daughter. Amber, what's going on? I hope you had a wonderful day today. Amber's over in the West Knoxville office, doing some injecting as well as nurse, doing pretty much darn near everything. So thank you, Amber. Thank you for being here. We got a crew coming in. Thank you, guys. If y'all got a question for Dr. Rogers, go ahead and put it in the comments. I'll make sure Doc sees all of these. Grandma Mary, happy Tuesday to you. I love you. D, what's going on? Great to see you. I'll make sure he sees this. Thank you, Bianca. Thank you. Man, we got to make sure he sees all these, wonderful messages. I think he's getting ready. That's awesome. Great to see you guys over on Instagram. Thank you guys for hanging out tonight. Tabitha, what's going on? From our Kingsport office, the lovely Tabitha. If you've been to our Kingsport office, you have certainly seen Tabitha. Great to see you tonight. Like I said, if you guys got questions, go ahead and put them in the comments. We're going to be with y'all till around 8 tonight. If Doc's ready to roll, let's see if we can get him almost ready. Rachel from our Johnson City Clinic, what's going on? Great to see you. All right, here we go. Let's bring in the birthday boy. What's going on, man?
Let's don't mention the birthday. Okay.
No, I'm sure there's people here who
talk about this guy. That's Mr. Rogers. I just found that somewhere. I think it's a stamp.
I want to say that's from. I think that's a prop from the diabetes tour guide.
Is that what that is?
It would be my
I
guess.
just found that on my desk. I'd rather talk about that than my birthday. I'd rather talk about Mr. Rogers.
Well, man, I tell you what, we've got a crew here tonight in the comments. Everyone's wishing you such a happy birthday, and
thank you.
And Mark made an ambitious guess on your age. And
89. I'm 89.
This year, I believe it's 69, isn't it?
69. Yeah.
Well, I tell you what, we got 49 people in here. Thank you, Barbara. Man, I wish I could. I want to make sure you get to see all these. Just so many, wonderful, beautiful. Thank you, Sherry.
Oh,
I mean, this is just so sweet. Guys, y'all are awesome. Thank you. Thank you. Katie's in here. Katie, what's going on? Great to see you. Diane, what's up? Holly, what's up? You know what? It's so fun, and you guys know Doc is my dad, and one of the great joys of my life is getting to work with you, and I get to celebrate your birthday with you in this way, and I get to celebrate it with 53 people here tonight. I feel like we're in a convention hall, answering health questions and celebrating your day, man. This is fun for me.
Well, I appreciate it. I can't believe you even want to work with me. So it's a good compliment. Thank you.
Honestly, it's again, I can't overstate how lucky I am to get to do this. Montana, what's going on? Great to see you. It is please tell me, Montana, is it your birthday? Whose birthday is it today over there? Montana's from our West Knoxville office, and I'm gonna be pretty upset if I missed a birthday over there. You know what, Lori, you got so many. Can you see those? Can you see the comments? On
Yeah.
the side there.
Wow. I'm just now looking at them. Wow. Thank you for this. Happy birthdays. That's wonderful.
That's right. Okay. So Montana's was January 6th. All right, cool. And April's and Amber's are coming up. That's awesome. Angie,
Wonderful.
thank you. Well, guys, we're answering health and wellness questions tonight, in addition to celebrating Doc's birthday. And we'll have to, if we can sing through the comments, we will. We'll figure out a way to do it. He said no singing.
No
he
singing.
said no singing. But he did say that we can answer health and wellness questions. Is that still?
Yes. Yeah, or play guitar if you want. You can play guitar. My favorite thing.
I love it. I see 7 Sea Surfer over on Instagram. Goodness gracious, Colonial Heights Dental Group. Thank you, guys. I love these guys being with us tonight. Look at that. Look at those. We got.
Oh, this is crazy. I didn't put that up there.
Well, I tell you what. Thank you guys for hanging out with us tonight on Dr. Rogers' birthday. Let's get to some questions, man. What do you think?
Yeah, let's get to some questions. I hope I can answer them.
Let's see. Well, I think you're getting more wisdom with age. Is that true?
If you don't, something's wrong. Yeah. If you don't get more wisdom with age, there's nothing that beats experience, in my opinion.
But before we get into these questions here, we got one on Humira coming up. How was it in office today?
It was a great day.
Was it a good birthday work day?
Yeah. I always like to work on my birthday because it's just fun. People bring you balloons, and I had treats in my office all day. Katie made me a big blueberry pie, and it was just wonderful. Yeah, everybody was great. It was fun. Thank you.
That is so cool. Man, shout out to everybody who got to go to the Kingsport office today. Thank you guys so much. Thank you for the team over there, making Doc feel special. And gosh, all 65, you guys are making me feel special just because it's my dad's birthday and y'all are hanging out with us. All right, let's get this first question here, Doc. And like I said, if you're with us live tonight, we're answering health and wellness questions. If you have a question for Doc, go ahead and put that in the comments. We will do our best to get to every single one. This one's on Humira. I've been on Humira for a few months for rheumatoid arthritis, and it's working great. The rheumatologist was giving me samples, trying to get me to age 65 in June. Okay.
Congratulations. Happy birthday. That's a big one.
It is a big one.
Medicare. You enroll in Medicare, which I've been on now for 4 years.
This is around kind of a Medicare birthday type question, because it goes on to say, I have private insurance, but they will not cover, and the drug companies will not help because I have insurance. So they already have insurance. They can only give the newer similars, which I'm interpreting as kind of newer generic Humira, essentially. Question is, do you think this would be okay? New scares me a little in our world today. Your thoughts would be really appreciated. Well, we really appreciate this question because I know this is helping more than just one person.
That's a good question because, a biologic drug like Humira is a type of drug that targets something in your body, like a reaction in your body, like inflammation in most cases with Humira. So it's really it's it's a really great medicine for people with a lot of autoimmune diseases, especially rheumatoid arthritis, which can be debilitating. So it's what's called a disease modifying drug. It doesn't cure it, but it just tampons down the immune response through acting on different biologic act on different things in the body, and they kind of block the body's response. In this case, inflammation.
Mm.
I don't remember if it hits the um, tumor necrosing factor, TNF factor, or which pathway it blocks down, but or inflammatory cytokine blocking medicine. But in the biosimilars, all that means is that it's a generic biologic. That's called a biosimilar. So basically, it's another company. It's not the brand name, so they can sell it for a lot cheaper. I think Humira was the biggest grossing, or has been the biggest grossing drug in history, but up until now, I'm pretty sure. I think Monjaro will overtake that
Yeah.
probably pretty soon, but it has been a great drug for a lot of people. They're making a lot of progress with treating a lot of these autoimmune diseases, especially in rheumatology. So, yeah, I mean, the quality control may not be what Humira is, but certainly I would be okay with it. I mean, it's just like taking a generic medicine versus a brand name. It's going to be, because it's not going to be affordable for most people that would have to pay for this drug.
Mm.
So it's now available as a generic brand, but they do rigorous testing. And matter of fact, I had a drug rep that came to my office yesterday, and he was selling or detailing Farxiga, medicine we use for diabetes. And so he told me, hey, and now it's come out in generic, we make the generic also. So he was promoting both the brand name and the generic. That's the first time a drug rep's ever done that to me. That was yesterday. So in a lot of cases, these generics are made by the same people that make the brand name. I don't know if that's the case with the Humira or not, but it's possible. So the technology's there, the patents kind of elapsed, and so it becomes affordable for most people. So I wouldn't hesitate to use it. I wouldn't. I don't think it's going to make a huge difference. See, though, I mean, even a tiny little difference could have a different side effect, or may not be as potent as the brand name. But I certainly wouldn't be afraid to try it personally, to be honest with you.
Great question, and that's I love those types of questions because they're give us a little context.
Great question.
And I know people are going through that, and we don't talk enough about it with certain
I don't
insurance.
blame you, especially for
Yeah.
something like that. I mean, it's worked great for you. You're hesitant to
Yeah.
change because something's a little different.
Yeah.
It may not be exactly the same. There's something, they call it similar for a reason.
Right.
It may have a little different filler in it, or a vehicle, that type thing. But I certainly would not be afraid to use it.
Thank you for that question. Great answer there, Doc. Ginger, I see you. Thank you. On behalf of Doc. Tiffany, I see your question. Thank you. Tarana, I hope I'm pronouncing your name right. Thank you. Great question there. Matt, I see you. Kathy, I see you. You guys are so sweet. Doc, you're getting so many birthday wishes.
Thank you. Thank you.
I hope you're able to see these in the background there. Thank you, guys. Y'all are so
Thank
sweet.
you.
Let's get to this right here. This is a question around statins, and I love it because I don't know that we can talk enough about this, because I know how you feel around statins and how unique it is to each patient. So question is, what changes can I make to get off a statin? My doctor is very adamant that I need this. It came over on Instagram. Thank you, guys. Obviously, you might need some more context here, but how would you how would you kind of talk about this?
Well, first of all, I'm not totally against statins. Some people think I'm totally against them. In certain cases, I use them. I usually use very low dose of a water soluble one like rosuvastatin. But in certain cases, they're helpful, not really because they bring your cholesterol down, which they do, but also because there's some evidence that it helps more by decreasing inflammation. So in certain cases, I will use them, but I'm not as liberal in using them as most doctors. Most doctors just don't look into it quite as deeply, like the particle size, the ApoB, all the different things. And there can be side effects from statins, no doubt. I mean, there can be quite a few side effects, from liver damage to muscle damage to worsening your, or maybe even causing, hyperglycemia, diabetes. There's been some questions about what it does with maybe increasing your risk of dementia. So there's a lot of things that you have to look into. So in other words, I just don't, your cholesterol is 240, here's your Lipitor. I just don't do it that way. You have to have risk factors, and you have to look at the particle size. So I don't blame you for getting off a statin, certainly if you're having a side effect from it or you're just scared of them. But remember, as I always tell people, a doctor-patient interaction is one of mutual decision making, with the patient being the ultimate decision makers. So, so you have a reason to ask why. You always should ask, why am I on this one? I have no other risk factors. My cholesterol is mildly elevated. And so get a good explanation, and then you can always get a second opinion on it. It's your body, it's your life. You don't have to do anything any doctor tells you. Believe me. But so say you want to get off a statin. A lot of people think, well, if I eat a low cholesterol diet, my blood cholesterol is going to come down. Not really so much. That doesn't work too well. If you just totally cut out your cholesterol foods like eggs, then your liver just starts cranking out more. A lot of people do have a generic form of hyperlipidemia where their liver just cranks out more than they really need, familial hypercholesterolemia. But if it's having side effects and you don't think you need it, if you don't have a lot of risk factors, the risks aren't worth the benefits to you, then certainly you can get off of it and use something different. I mean, certainly you could use something like Zetia, which is not a statin, which really works more on the absorption of cholesterol than blocking down the production through your liver like a statin. So you could try that. That's a prescription medicine. You could certainly try other things, like one of my favorites for bringing down cholesterol naturally would be tocotrienols, which is a special form of vitamin E, which I'm going to do a deep dive on vitamin E. Somebody asked me a question last week about vitamin E, which forms to use. There's a lot of different forms of vitamin E, and tocotrienols are a vitamin E cousin, and as opposed to tocopherols, which you think of as, most people think of that as vitamin E. But anyway, I do like the tocotrienols that works pretty well. I just don't see side effects from it either. Garlic, you could use hawthorn. There's a lot of herbals that can make a difference. Certainly nothing ever replaces what you eat and a good exercise program. So I look at it from a broad perspective. Number one, I don't freak out just because your cholesterol is a little high at all. Your body needs cholesterol. And I take a lot of people off of it because their cholesterol has been driven too low. Remember, all hormones come from cholesterol. Yeah. You have, in that steroid pathway, you have cholesterol goes into testosterone, goes into estradiol, goes into progesterone. The mother hormone is really pregnenolone. But so cholesterol is certainly a precursor to all the other hormones. cortisol, etc. So you need it. You don't need to bottom it out either. Again, more importantly is what your ApoB number is, which represents the size of the mixed size of the LDL cholesterol particles. Try that, and certainly it's your right. Another thing too was I was listening to one of Dr. Atiya's comments this past weekend on statins, and he's for statins. He likes to drive your ApoB really low, but there's trade-offs to that because a lot of side effects. The only way you're going to drive it that low is by use of a statin, and maybe one of the PCKS inhibitors. But there's no reason to drive up your doses. You really don't need to go over 20 milligrams of any of these things, I don't think. You just don't get the benefits of going up into these high doses. So, if you have to have it, you have a lot of risk factors, use the lowest dose you can, preferably use a water-soluble one, like rosuvastatin, Crestor. But look at it in that way. There's some alternatives. Certainly, get off your statin and see where your baseline is by getting a Cleveland Heart Panel and looking at or Berkeley Heart Panel, and look at where the breakdown is, where your problem is. A lot of times, where your problem is really low HDL, which a statin doesn't help, makes it worse. Or maybe your problem's triglycerides. So you got to, there's a knee-jerk reaction by a lot of doctors to put you on these statins, and it shouldn't be a knee-jerk reaction. It should be a well-thought-out plan, assessing all your risk factors, looking at your coronary calcium, your blood pressure, insulin resistance numbers, family history, things like that. So look into it a little deeper and go for a second opinion if you want.
Yeah. And I love that you said that about the second opinion. I think that's important for all of us in here to hear. And, one thing I'm hearing is just, let's be more thoughtful around statins. And so I really appreciate this question. I hope that answer, helps a bunch of people in here tonight. And if you guys need any clarity, please, put a follow-up question in there around statins. It's a topic that I know we can't talk enough about because they're so popular, for one. So
they are. This is a dirty little secret, but doctors get bonused indirectly and rated higher the more statins they use, which is really unfortunate. It's not even what it brings your cholesterol down to. It's whether you put that patient on a statin, you get a ranking. And a lot of times, if you're in a pay-per-performance model in primary care, you're really going to screw yourself by not using one. So you got to be a very honest doctor, knowing when you shouldn't do this. So don't let those type of things. That should be off the table. So that's a dirty little secret about use of statins and really blood pressure medicines as well, and maybe diabetic drugs. So it's kind of unfortunate. That's one reason that I run a cash practice. Matter of fact, if you listen to that podcast with Rogan and Bueller from a few weeks ago, who's very knowledgeable, this Bueller guy is not a physician, but he's worked in medical care for many years and wearing different hats. But he explains what's happened to our healthcare system better than anybody I've ever listened to. So it's well worth that listen when you listen to him. And near the end, he goes, the only possible way a primary care doctor can be an excellent doctor is to do cash. And I agree with that. 18 years later, I'm glad I did. It certainly makes me a better doctor and gives me more time. I don't have to be influenced by insurance companies or directives or things like that. So take that for what it's worth.
And if you guys we'll probably need to link that episode in the comments at some point, because it's powerful. And we think, one of the purposes of this show here is to equip you guys with the tools you need in order to make good, healthcare decisions. So thank you for bringing that up, Doc.
Your average person's jaw will drop when they listen to that if they don't know much about the healthcare system.
Yeah.
The
These are
number one bad boys are the insurance companies, because they're getting it from every end.
Yeah.
They are not going to lose their profit. Their only motive is profit. There's no doubt about that.
I see Lisa's wanting that link. We'll put that in the comments, Lisa, over on Facebook. Carter, what's going on? Great to see you. Golly, I'm seeing so many friends in here. So many of our team members in here. Thank you guys so much. We got 72 with us tonight. We're celebrating Dr. Rogers' birthday and doing what we do every single Tuesday by answering your questions. Thank you guys for being here. Susan, I see you. Tanya, I see you. Tamara, thank you. So many. This is so cool. So for those who don't know, if there's anyone here who's new to the show, we do this every Tuesday at 7, and we put up. We have a couple different shows that we put up every Tuesday, and this week we had like some of our best ones went up this week, oddly enough, and this was a favorite of mine. And Doc, I want to ask you more about this, but the Common Sense MD was on addiction medicine with Dr. Chip Backus at Emmaus Medical Counseling, and he was just amazing. I listened to that, and one just I could literally hear his heart for these patients who struggle with substance use. And one, if there's anyone in here tonight who knows somebody who struggles with addiction, or maybe you do yourself, I'd really encourage you to listen to that. And Dr. Backus really comes at it with just a very multifaceted approach, and one that I really appreciated. And Doc, you did a great job with that interview. That was a really, really fun one to watch.
Oh, that was a good one to do. He's a fantastic person, and does it for the right reasons. And, it really sheds a lot of light on addictions and what's can be done for it medically in the right way. Yeah. He certainly does it the right way. So yeah.
Shout out to Dr. Backus. And on Explain This, the star of the show, Robin Riddle, is explaining why you should choose performance medicine. And I just love this episode.
I need to listen to that. I still haven't listened to this one. That's great.
Yes, it was a really, really fun episode to do. And her passion really spoke in this episode around functional medicine and kind of the variety of services that performance medicine offers and can help patients with. So if you guys don't know everything that performance medicine does, or an office like performance medicine, there's functional medicine clinics all over the country. And I really think Robin does a great job in this episode detailing, what type of service that is. And, as well as, the quick care stuff we do, the aesthetic stuff. I know Amber's in here tonight, do a lot of injecting and a lot of medical aesthetics. So it was super cool to do with her. And obviously I'm biased and have a huge passion for performance medicine and everything that it stands for. But we get into the cash only part and why that's important to patients. And so I'd encourage everybody in here tonight to listen to that at some point. It doesn't have to be today or tomorrow, but super cool episode with Robin on Explain This. And I'm seeing people getting, we got questions coming in. Thank you guys so much. Justin, thank you for that comment over on YouTube. Kristen, I see you. Stephen, I see you. I want to put this up for the diabetes tour guide here. We're going to get to live questions here in just a second. My brother Andy has a YouTube channel called the Diabetes Tour Guide, and this week he did an interview with Linz Edwards, who is actually a well-known actor. Literally, you need to look up his IMDb. Is it IMBD? But he's a well-known actor, and he talks about living with type 1. And I don't know if there's any parents of type 1 in here tonight, or maybe there's somebody with type 1, but he was diagnosed at age 2, and he's literally lived a lifetime with it. And he goes over a very kind of a heartfelt conversation around, some of that struggle and how he views type 1. So Andy did a great job with that interview. I was super proud of him.
Wasn't he on the Hunger Games or what else? He's been on some pretty big stuff, hadn't he?
I think maybe Nashville was one.
Yeah, he was on that show too. Yeah.
And maybe the Hunger Games, but it was super fun. This guy was so honest, and a huge shout out to Lens. Thank you so much for doing that interview, and shout out to my brother Andy for hosting that. That was really, really cool. We're going to get to live questions, guys. Thank you all for being with us this evening. Velma, I see your question. We're going to get to everyone tonight. And team, if I'm missing something, let me know. We'll try to. I'll try not to miss any, because I'm looking. I see my Instagram people as well. We're going to start over on YouTube. One step forward. I have a friend that was diagnosed with ALS. Her symptoms from the beginning are getting worse. She now has a feeding tube and weighs under 100 pounds. Her symptoms are muscle twitching, throat spasms, difficulty swallowing and talking, tongue quivers, and right vocal cord doesn't work. Lots more. Is there anything you can do to help her? Man, I'm so sorry. One step forward. Doc, what's your thoughts on this? This is around ALS.
Yeah. I wish I could tell you there was something I could do to help her. But, medically, there's a lot of stuff in the pipeline. From what I hear, it's all experimental. Nothing's been proven to really cure this. But it's a toughie. We just lost a good friend this past weekend with ALS. And it's just tough. When I heard the news of his passing, he suffered for 4 years from it. And, I really just was relieved for him, to be honest with you. I mean, our prayers go out to you, and certainly did to him. And last time I talked to him, the only thing he could do was communicate. The technology in allowing these people to live longer than they ordinarily would has been incredible. Where he, like last time I spoke with him, he certainly couldn't talk, but he could just look at a keyboard and his eyes would focus on a letter. He'd spell it out for me. So I would just read what he was trying to tell me.
Yeah.
And he was always really faithful to the end, and just admirable, really just incredibly admirable. And so were the people who were his family and friends that, pushed him in the races and things like that. But it's just sad,
Yeah.
I wish there was something, that it sounds like it's pretty well into it. There's a lot of things that people read about, but personally, and I've known several that have had it, and I've never seen anything that worked that good, to be honest with you. I hate to be such a downer about it, but I wish I could say something positive. I just can't,
One step forward. We're going to be, praying for your friend, and we certainly appreciate you asking this question on behalf of her. And Doc, thank you for that answer. It's a, probably not one that, one step forward wanted to hear. But thank you for putting that in there. And like I said, we're going to be praying for your friend. Thank you so much for putting that question in. Guys, we're going to keep going here. If you guys have a question for Dr. Rogers, go ahead and put it in the comments. Let's see here where we're at. Let's see. I'm going to there we go with Deborah over on Facebook. Thank you, Deborah. Friend tested positive after 15 days of COVID. Thought this was a long time to be testing positive. Is this a common thing? Common thing with COVID? So this is around testing. And what's your thoughts on this?
Yeah, it's not too unusual. Hopefully they're getting over it. If they're still symptomatic after 15 days of it, certainly they need some treatment because they probably have a bacterial superinfection. And um, so it depends on the symptoms. The testing, I don't really care too much about. The tests are terrible anyway. They're extremely unreliable. Um, you know, they're not even sure how many cycles are in these things that they run. They run up the cycle time. So even I have a feeling even the colds are going to show positive for COVID the way they test these days. So they're inaccurate. Just look at the clinical side, how they doing. If they're sick and need treatment, no matter if they have a COVID, the flu, RSV, bronchitis, a cold, whatever, um, they need treatment for it if they're still sick after 15 days, because you can get other things that kind of hop in on that. Once your immune system's knocked back a little bit, you're more susceptible to picking up these other bugs. Mm-hmm. So if they're doing great, and don't worry about all the testing, if you feel great, don't even test. That's my, because you're not, unless you're especially that far out, if you're not running fever or coughing all over everybody, you're not going to be contagious anyway, unless you're symptomatic. I mean, there's a whole lot of rhetoric that went around that was completely wrong during the COVID days, but certainly COVID's still around.
Yeah,
it's all over the place. I mean, we still treat it. It just doesn't seem to be as bad as it was. I know it's not. I mean, if people are dying these days of COVID, there's something else going on. Either that, or they just let it go and didn't treat the bacterial superinfection or taking an antiviral. So if they're fine and just still testing positive, quit testing.
Yeah.
What use is it?
Deborah, thank you for that. And this actually goes right along with what you're saying, Doc, with what's going around right now. Coal miner's daughter is asking, how bad has flu A been for your patients? I had it 2 weeks ago. I was in ER 3 times, sickest I've ever been. I do have POTS and autoimmune issues. Wasn't able to walk for 5 days. It was awful. Coal miner's daughter, I hope you're getting better. I hope you're feeling better. We'll certainly pray for you. That sounds awful. Doc,
yeah,
what are you
it's been, yeah. I mean, the people who've had that have been way sicker than the COVID patients that I've seen, in the last 2 months, for sure. Hopefully you got some Tamiflu, or, Flumidine, one of those, and hit it early. If you didn't hit it early, it doesn't work. You got to hit it within the first 24 to 48 hours at the least. But, you can get pretty sick with it. Hopefully you got treated for it, especially if you have POTS and autoimmune disease, your immunity is probably a little bit weakened. And yeah, I mean, you can get really sick with that. It sounds like you're better. I always hit people pretty hard, whether it's flu A, B, which tends to be worse, or RSV or COVID. I always hit it pretty hard with everything we have from the get-go, including all the high dose vitamins, and I always put people on Zithromax. It's even though it's an antibacterial agent, I think it works for viruses. I've just seen it so many times. I think it's helpful for that too. And with COVID, they kind of proved that. But at least, by observational studies. So hopefully you're better, but yeah, I've seen some really sick people, way sicker than the other ones.
Thank you for putting that in there, Coal miner's daughter. We hope you're feeling better. Keep us updated. Let's get to one question I will ask you, Doc, is, will you jam with Holly's dad at some point? What's your? Can we?
Yeah, definitely will.
Can we organize this?
I talked to Holly's dad today, and man, he's on a different level than I am. But I think I definitely want to. I want to get the band back together. Okay,
Holly, let's make that happen. We need to get the band back together. Get this jam.
Your dad's awesome. We had a good little chat. We ended up talking more about guitars than we did, and the Beatles. he's a huge Beatles fan, as I am, than we did medicine. But he's in good shape.
That's awesome.
He had an impressive blood work in Cleveland, and certainly really enjoyed talking to him a lot. I wish I had more time, but it was fun.
Thank you, Holly, for putting that in there. Let's get to
Holly. He told me, as a matter of fact, he told me a funny story on you that I'll have to tell you later on. But when you were a kid, he had a couple of funny stories about you. I thought they were hilarious.
Thank you for being here, Holly. Let's get to Rick's question here on YouTube. I just started semaglutide for weight loss, taking 25 units weekly, 25 units once weekly. What's your thoughts on fasting a couple days after taking semaglutide? I inject on Sunday and fast Monday and Tuesday. Thanks for the question, Rick. It's a good question.
Yeah, I'm okay. I like fasting. Well, if you can do a water fast 2 days in a row, that's pretty good. Unless you're dropping on your sugars, if you're really insulin resistant, meaning your insulin's too high, doesn't work as well, and you're getting hypoglycemic, you got to be careful with that. But make sure that your electrolytes are good. You're drinking plenty of electrolyte mix and all. But yeah, more power to you. You're definitely going to lose more weight that way. I really like fasting, even if it's just intermittent fasting. But kudos to you if you can fast for 2 days straight, with just a water fast. That's pretty impressive. I've done it, and it's hard.
Rick, thank you for putting that in. I love these different strategies along with the semaglutides, the Ozempics, the Mounjaros. I'm going to put this up here. My man, Brandon, one of my best buddies is with us tonight. And I just want to give a shout out to TextCare. TextCare, Brandon does the spiel better than me, but it is the future. So Brandon, thank you for hanging out with us tonight.
I need to get him on a podcast with that.
We need to get Brandon on a podcast. Brandon, can we make that happen?
Work it up, Brandon. Brandon's a great tennis player and a great pickleball player.
Yep.
The sport of the future, pickleball.
I agree. I got my Jula. It's a Jula.
Yeah.
Mm-hmm. Not to be confused with it. I think a Jula is a vape too. It's not a vape.
Yeah.
Vape's not good for
you.
He
got it's a paddle that I got Ben for Christmas, and I'm hoping it improves his game.
Let's get to thank you, Brandon, for being with us tonight. I know you're on a work trip, so thank you for taking the time. Tarana here is on Facebook, and you're saying I'm pronouncing it right. Thank you. Tarana is saying, does performance medicine do brain mapping? That's an interesting question.
Not at this time, but it's kind of a new thing that's going on, and there's a lot of good strategies for. Look at my dog here coming up, trying to get on here on the show. She likes to lick my neck, but yeah, brain mapping is something that's really interesting, fascinating, and there's a lot of things that they can do with stimulation, whether it be different modalities like ultrasound, magnetic therapy, where say you take somebody that has PTSD and you find out through brain mapping that they're not getting those signals from the base of their brain to their prefrontal cortex, and they're doing things that can really enhance that. Even they're using psychedelics for this too, so it's really interesting what's going on. But at this point, no. But every meeting we go to, there's always somebody out there doing it. I'm kind of waiting till I do a little more research on it and see the results, but certainly it's an awesome thing.
Thank you, Toronto, for putting that in there. Love talking about, where health and wellness is going, all the new innovations. That's super cool. We'll for sure be talking more and more about that. Let's see here. I want to put this up from Andy Margaret. Thank you. This is so sweet. Thank you for this kind comment. You're the absolute best. Thank you.
Thank you.
Let's get to, let's see here where we're at. Tiffany, Tiffany, I loved seeing this because I don't see many Rogers without the D. So it's very cool to see a fellow Rogers
We may be
ROG.
related. We may
Yeah,
be related.
I love that. So Tiffany, thank you for being with us tonight. Tiffany's question is vitamins to help with lymphatic buildup in arms. I have lymph nodes removed and I'm noticing swelling 5 years after surgery. Doc, what's your thoughts on this?
I don't know why pycnogenol comes to my brain, but I would definitely take the whole gamut of all the recommended vitamins as well, especially the ones that have some anti-inflammatory, antioxidant properties, like the flavonoid class of drugs. The green tea is certainly one that I think would help. I like lymphatic massage. I like jumping on the mini trampoline. I have one right back in my workout room that I think really helps build up.
Mm-hmm.
But and there's various ways to do lymphatic drainage. Some of the massage therapists are well trained in it, and some of them use electrical currents for it. They almost look like light bulbs. I've seen it done. So I'd say the drainage. I would say the manual drainage is going to work better than anything. Even with brushing, skin brushing helps. But I don't know of any others that come to mind other than the ones I would ordinarily recommend that are anti-inflammatory in nature. But moving that lymphatic fluid manually, I think is the best strategy.
Tiffany, I hope that helps. Thank you for putting that question in there. Let's see here where I'm at. I'm going to put this up from Justin. Thank you for this. Love the episode. Cool. Super cool. I love that, Justin. Thank you so much for being with us tonight. Let's see where we're at. Guys, if I've missed you, I apologize. This is Roel here. Lately, there have been bad press on Metformin. Any thoughts on why? What's your thoughts on this?
There's always good and bad with Metformin. You can look at any one time, and you'll have great things about Metformin, and then you'll have negative comments about Metformin. Metformin is not an innocuous drug for sure. It can definitely cause side effects. The most common, of course, is diarrhea, loose stools at least. But it also can deplete your B vitamins. It can deplete CoQ10. So, and a lot of people think, well, this prevents cancer. Some people say it may increase your risk of cancer. So there's a lot of, different studies show different things on this, and I'm as confused as anybody. I prefer taking berberine myself just because I don't get the side effects of.
Are you still with us? I think Izzy just unplugged the earphones. There we go.
Just about ripped my ears off, man. But anyway, so there's good and bad. There's good and bad things with Metformin. If you read a lot of the alternative treatments for cancer, almost every one of them thinks you should use Metformin. It's very anti-cancer in that way. There's always good and bad press on Metformin. If you look at a lot of the longevity experts, as far as living longer, Metformin is always at the mainstay. That and rapamycin, are the two mainstays with that. And there's another one called acarbose. It's probably even better than Metformin for longevity benefits, especially combined with rapamycin. But the unfortunate thing about acarbose, it's a lot more GI side effects than Metformin. There's not many people that can tolerate it on the GI tract. It's the word for that is precose. We used to use it it's for diabetics. It really works great for diabetics, but it really kind of causes fermentation. It blocks carbohydrates from being absorbed in your colon, and it ferments them. So you get terrible gas and a lot of GI stuff. But man, it's a great longevity drug. Um, I'd probably be taking that myself if it weren't for the side effects. I haven't tried it. I'm kind of hesitant to. But metformin, I'm just kind of hoping that because of the mechanisms that metformin's proposed to work for longevity, mainly by helping overcome insulin resistance, that that it does prolong life and helps cancer as well. So if I had to lean any way right now, and I'll read a lot about this. I'll read a lot of longevity studies. I look at ATIA. I'll listen to an article about the acarbose, metformin, rapamycin this past weekend through one of the A4M lectures in Vegas recently, and very pro metformin. And if you look at a list of the supplements that most of those experts on longevity take, metformin is on most of them. Rapamycin certainly the heavy hitter. So, I'm not against metformin at all. I don't think it causes cancer. I think it more leans toward preventing cancer. But, certainly in making a decision, see if you can tolerate it first on your gut. And but it's a really great question. And that's a great question, because I'll see great things and I'll see bad things the same day on it. It's different schools of thought on that.
Well, thank you so much for putting that in there. We're going to be talking more and more about metformin. As Doc said, there's different stuff coming out all the time. So
if you're insulin resistant, I'd get on it. If you're doing great and have no reason to, you might not want to do it.
Well, I hope that helps, man. Thank you so much. Sandy, I see you. Great to see you in here. Thank you so much. Let's get to Stephen here. Happy birthday from the Pattons. That's so sweet. Thank you, Stephen. Okay. I'm starting third week of Qulipta, and I have had no migraines thanks to you and Katie's recommendation. Are there any long-term side effects with Qulipta? Huge shout out to Katie there. What's your thoughts on this?
Yeah, Qulipta is a good drug. It's a daily prophylactic medication for migraines, and it seems to work pretty well. Matter of fact, the rep came in today. So yeah, and Katie certainly, I don't think she'd mind me telling you this, she has migraines, and she gives a lot of my patients great recommendations. I think she's tried most of the interventions and still gets some of them. And so, yeah, that's fantastic. I think I can't tell you the exact mechanism it works by right off the top of my head, but it seems to really cut down on the number of headaches. There's a lot of different modalities, from Emgality injections once a month to Botox, a ton of Botox in your scalp and neck, to, gosh, everything. There's been Topamax. There's been all kind of beta blockers. They try everything in the world. But I will tell you, if you have migraines, there's a lot of new stuff that's out. So I tried all. There's even a new nasal spray for acute. I forget the name of it, but it's brand new. But it, according to Katie, it just stings and tastes and smells terrible, but it knocks it out really quick, way quicker than the new Kids on the Block, which is Nurtec and Ubrelvy. So, but Qulipta seems to be the one that has the less side effects for prophylaxis that I've seen right now. So good. And long-term side effects, I don't know. It hadn't been out that long. So, if you can believe what the rep tells you, it's safe. So it's hard to say. Just like there's really, like even Ozempic, we haven't used it for long-term yet. But certainly the benefits of Ozempic seems like it far outweighs the risk in most people. And if you start getting GI side effects from it, stop it. But certainly there's been a lot of bad press on that too.
Yeah.
Recently on Ozempic, when it's a great drug, it's not for everybody, but a lot of the new studies, really said it really is brings about a 30% reduction in cardiac events, overall, and can reverse non-alcoholic fatty liver disease. So again, we're talking about Ozempic, Mounjaro class, but so stay tuned. If it's working, try it, and then maybe wean off of it if they're gone. Sometimes if you put something into remission, you can wean off the medication.
Stephen, thank you so much for that question on Qulipta there. Great question around migraines. We're going to get to Kristen here. Aside from the Cleveland panel, what would be your next recommendation as far as general health testing for a 40-year-old female currently on thyroid meds? It seems you're seeing Fran at the Johnson City location. That's awesome. Fran is the absolute best. So thank you for putting that in there. This is a great question, Doc. What's kind of that next step? It seems that she's doing great. Wants to keep doing great, stay healthy. 40 years old, currently on thyroid meds. What's your thoughts on this?
The Cleveland is so encompassing that it really covers most of the stuff, but it depends. I mean, if you're feeling great and don't need the other tests, then you don't have to over test or anything. I don't believe in over testing or over treating, but certainly that's the best screening test that I've seen so far. There's other things you can check though. I mean, if you really want to take a deep dive on your thyroid, you can always do an expanded thyroid panel. You get reverse T3 and TPO, antithyroid globulin antibodies, because monitor your response to the medication that you're taking, and tamponing down that autoimmune Hashimoto's titer. But certainly keep a close eye on your hormones being 40 years old, because they're going to start getting a little wacky in the next 10 years. So keep an eye on those. But sometimes I do a lot of gut testing. If you have any gut problems, look at the GI map and see if you've got anything there that could lead to problems down the road. Again, a lot of what we're talking about, screening test. Sometimes I like to do food allergy testing just to look at that. And sometimes I'll even recommend some genetic testing to look at that. And again, there's a couple genetic tests on the Cleveland, the ApoE and the MTHFR genes, which are important. But sometimes you can even do a 23andMe and see what some of your other genetics look like. Sometimes you can be opening up a can of worms with that. But, for example, if you have the MTHFR mutation, you might want to look at your COMT gene. That's very important. But so gut mapping, genetic testing, a lot of the future. Another test that you could consider getting is a salivary test to determine which medicines that you react to better and those that you should stay away from. We used to do a lot of that, but the insurance companies quit taking it, and there were some kind of nefarious companies that got into that and they weren't that accurate, but I found it to be pretty useful, from a standpoint of, if I have to use a medicine, which one your DNA would be better at breaking down and processing. But certainly, when you get in your 40s, you need to start thinking about looking at your colon. Colon cancer is coming at an earlier age. And a lot of it has to do with the environment we're in. Certainly, you could always check heavy metals, and look at that if you're worried about it, exposures. But yeah, so there's a lot of stuff you could do. But certainly the Cleveland's by far the best one we do. If you have risk factors, sometimes I'll get a CT calcium scoring for your heart. Look at that. Keep an eye on your skin. Skin cancers are the most common type of cancers, not cancer killers, but most common type of cancer, skin cancer. So those are some of the things you could think about doing, but certainly you're getting the best when you get that Cleveland.
I love that question. It was so prevention oriented. So thank you for putting that in
You
there.
could always get
Yeah.
a Dutch test,
Yeah.
which tells us a lot of stuff about how your body metabolizes different forms of estrogen and neurotransmitters. That's another thing you can look at through different testing, salivary testing for neurotransmitters. You can do an expanded vitamin mineral panel to see if you're deficient in other vitamins or minerals like zinc, manganese, vitamin A. I've done that one on myself, just an expanded vitamin panel.
Kristen, thank you so much for that. And we're going to keep going here. I want to get to as many as we can. We're gonna cut it off here just shortly here. I'm going to put this up from Jeff. One, this is just so kind. Thank you for putting this in there. It means,
Hey,
means
Jeff.
a lot to us.
Oh,
Thank you.
great. Thank you, Jeff.
All right, let's keep going here. I see Leslie's question, and then I'll get to Lisa. I see you, Lisa. Are you seeing a lot of pneumonia right now or symptoms that mimic pneumonia? What's your thoughts on this for Leslie?
Well, I haven't seen a ton of pneumonia right now. To diagnose pneumonia, I like to get a chest x-ray to prove it. Now, you go to a lot of places, they're going to do a blood test for walking pneumonia, which is mycoplasma. So they may do this blood test on you to run your bill up and tell you have walking pneumonia. Almost everybody's going to turn positive for mycoplasma if they've been exposed to it, which most people have. So I don't really think that's a great infectious disease test. So not really, we're just not seeing the complications that we saw with COVID 2 years ago. We're seeing a ton of it. Then, of course, we're just not seeing any more than usual. I've diagnosed a few cases this winter, but not near like before. And symptoms that mimic pneumonia is bronchitis. So I'm one that treats. I like to treat early. I don't like to say, oh, that's probably viral. If it's not better in a week, we'll think about treating you. I like to start treatment early.
Leslie, I hope that helps. It's a great, timely question. Thank you so much. Let's get to Lisa here. I want to help Lisa out. Lisa always shares the show. Thank you so much. I was admitted to Indian Path Hospital 4 days last week for low potassium, low calcium, anemia, and my creatinine kinase was almost 1,000. Do you think it's because of my 120-pound weight loss and 23-hour fasting? Lisa's had significant weight loss here, has gotten off insulin, I believe. The hospitalist doesn't know why the CK level is so high. Muscle breakdown is happening. Thinking autoimmune. What's your thoughts? We're thinking about you, Lisa. Thank you for being here.
Yeah, gosh.
What's your thoughts on
sorry
this?
to hear that. Certainly, hopefully you're not on a statin that could cause that. Usually when the CK gets that high, it does indicate some kind of muscle damage. I've seen it happen after too much exercise. I've seen it happen after you have pneumonia, like we just talked about. But it sounds like your electrolytes got out of balance. Again, you may have been too fastidious about it with the fasting. Some people can't tolerate fasting like that. So obviously you don't need to be doing it right now. And hopefully the CK levels will go down. We used to check those. We looked at different forms of CK, like if it's an MB band or an MM band. Now they have troponin levels to look for cardiac damage. I bet it's because your electrolytes are off and you're fasting. So if you got those corrected and you're not fasting right now, I bet you return to normal pretty soon. Just make sure they recheck those levels. Now, there's some autoimmune diseases that can do it, like dermatomyositis, and that which is a really harsh one with muscle breakdown. So you always have to think about, is Is it dietary? Is it from medications? And certainly statin, which you probably hopefully you're not on the statin, but that'd be the first thing that would jump out at me.
Not on
Any
statins.
any new medicines that you've tried? But sounds like to me you got your electrolytes all unbalanced, and your muscles started probably trying to pump out some, and that's what happened. Your body kind of, through your fasting, your muscles were breaking down, and kind of chewing on your own muscles and putting out that CK level. So hopefully, you'll get back to normal. And again, you've lost that much weight, so just don't think you can keep on doing that at that rate. And so you may hold on the fasting for right now and replenish your electrolytes and continue a reasonable diet. Really interesting. And if you look at your medications too, hopefully your liver and pancreas tests were normal. And if you're on the GLP-1s, probably hold off on them for a little bit.
Lisa, thank you so much. And guys, what I'm going to do, we're going to do just a couple real quick ones here, and I'm going to make sure I write down the ones that we didn't get to. We're going to have to call an evening. I tell you what, I appreciate you guys so much for being here. Make sure you come next week. We'll be here Tuesday, 7 p.m. We'll answer any ones that we didn't get to tonight. I know there's so many great questions in here I did not get to. I want to put this up from Sandy real quick. I want to try one of your CBD gummies. Which one would you recommend for me, as I've never tried them? Do you have like a good beginner one?
Well, yeah, we have different ones for different reasons. There's a lot of different formulations of CBD. If you just want it for a little bit of pep, energy, take the energy one. If you can't sleep, take the nighttime gummy. The one you got to be careful with, which is actually the one we sell most of, but one I did not like at all, is the Delta 8, because the Delta 8 actually has a little bit of CBD in it. And I did not like that. It made my heart race. So I'd be cautious. I probably would not use the Delta 8. It's a red one. So, but the other ones, the muscle and joint one too, if you have a lot of aches and pains, if you're like me, you're getting a little age on you, and there's no way Sandy can be as old as I am, even though I think she may be close. I don't know. She's a 50.
She's not nearly your age. I know that.
Thinking she was born in 55 like I was. They just stuck in my head. If that's true, put it on there, Sandy, because that makes I have a great memory and I'm not getting dementia. If you were born in 1955, put it on there. Just give me a thumbs up. You know what?
I'm going to do this because she actually put this in there earlier tonight. 5 months older to the T. So
I told you. She was
55.
born in 55. Yeah. Sandy's a great nurse and she's very healthy, looks way younger than I do. So probably the one I like is the muscle and joint, because I tend to have a stiff back, so then if you just can't sleep, try the nighttime one.
Thank you for putting that in there, Sandy. I want to make sure I get Glenn on LinkedIn, because I really appreciate you connecting with Doc on LinkedIn. And I know fenbendazole is something that's been a kind of a wild topic. I don't know if how quickly you can answer this for Glenn. And I know, fenbendazole has some.
I haven't seen it to have a lot of side effects. Again, it's an alternative treatment in addition to the traditional treatments for cancer. Some people take it prophylactically, but they're studying it in a lot of Ivy League type places. If it doesn't upset your gut microbiome, which is possible, I think it's safe. So I'm a big fan of it. But again, I always think, why are you taking it? Do you have a legitimate reason to take it? Or mebendazole. Mebendazole is the human form of it. Fenbendazole is more, you get it through animal sources, but it's the thing about mebendazole It's just a tiny bit different, but mebendazole is unbelievably expensive. Nobody could afford it really. But it's mebendazole, we treat little kids with pinworms with it. So fenbendazole, although it's geared more towards the animal kingdom, treatment of them, dogs and things, it's an anti-parasite drug. I certainly, if it was me, I would take that over mebendazole just because of the affordability. And I have a lot of people on it, and I hardly ever have anybody complain about it. Of course, it's going to get downgraded like ivermectin was, of course, as being a dewormer, even though it's a great medicine that's treated millions of people for different reasons. So in the UK, it's pennies on the Fenbend. Yeah, Fenbend's not expensive. Mebendazole here is really expensive, though.
It might be talking about mebendazole over in the UK.
Oh, I don't know. Yeah, it's expensive here.
Well, man, Glenn, thank you so much for that, and thank you again for asking the question around that and being with us tonight. Cool. It's Fenbend or Mebend is cheap. Guys, I know Doc he's got a small little is it a birthday party? We're gonna make sure that he gets to
I don't think I'm having a birthday party.
Doc, I tell you what,
the dogs are coming.
I appreciate the time tonight. I'm seeing questions that I missed. I know I missed let's see here. One. Thank you so much, Dee. That's so sweet.
Thank you.
Allison's wishing a happy birthday as well. Emily,
I'd like to go to Tinsley Bible. It was great. Good seeing you there that day.
And there's Ike.
This is called man's best friend. When everybody else fails you, this guy's going to be there.
Hey, we're going to make sure we get all the questions we did not get to tonight. And we'll get to those next week. We're here Tuesday, 7 to 8 for the Performance Medicine Show, answering your health and wellness question. Dad, I'll tell you what, man, happy birthday. I love you so much.
Love you too, man. Thanks. We had a good one.
There's
Appreciate
Izzy right
everything.
there.
Appreciate all the well wishes. This is Izzy, and she's not going to leave me either. She's with me.
Happy birthday, man. Honestly.
Hey, thank you.
It's so cool that I get to do this with you on your birthday, with all of our friends here tonight. Thank you all for hanging out with us. Like I said, if I missed you, we'll get to it next week. I promise. I apologize for missing some questions. We'll be back Tuesday, 7 o'clock for the Performance Medicine Show. Doc, I love you, man.
Love you too. Thanks for all the happy birthdays. Good night.
See you guys. All right, where's my outro? Where is it? There we go. There we go. Brand new outro. Love you, man.
Don't go away.